Hello, my name is Amy Sturkey. I am a pediatric physical therapist, and I've had several different families contact me to ask me to do a video on toe walking. So toe walking is something that physical therapists go to a weekend-long workshops on. Toe walking. It's a complicated topic. So this is just a basic one for the parents. So toe walking is not a normal variant in development. In normal development, kids walk around 12 months of age, and and they start off when they start walking with their feet flat on the ground. But by 6 months from the time that they start walking, they start getting a heel-toe pattern. So they walk and their heel hits first, and then their foot rocks down and their toe comes down last. So if toe walking persists beyond 2 to 3 years of age, you really should consider a referral to physical therapy to address a toe walking problem. And if toe walking persists longer than that, 2 to 4 years of age, the research says that there starts to be a decrease in the ankle movement or the range of motion of the ankle. Okay, so first you have to kind of talk about the movement of the ankle. So when you pull your foot up, that's called dorsiflexion, or your toes going, your foot including your toe going up. And when your foot's going down, they call that plantar flexion. And if your child toe walks, then they are more likely to stumble or fall and have injuries. And as an adult, if you are a toe walker or were a toe walker, you're more likely to have foot pain. So if your child was a toe walker, you could go to your pediatrician, or you could go to a neurologist or an orthopedist for them to start the process for a referral for help for your child who has toe walking. If you have a sudden onset, your child didn't toe walk and then started toe walking, then definitely you want to go see a neurologist or an orthopedist. Now, sometimes things go along with toe walking, such as learning disabilities or speech problems, and also sensory issues. So if your child has sensory issues, you might want to see an occupational therapist. If your child has speech problems, you might want to see a speech therapist. The physical therapist, though, is a person who is considered the primary person to work on treating toe walking. Usually people think about two main ways or reasons that a child is toe walking. One is neurological. So in really significant cases, a kid could have cerebral palsy, and so toe walking is a part of a bigger range of problems that a child has. But it can be neurological in order. It can be a myopathy that's caused a problem, or a tethered cord that has caused a problem. It can be a part of pervasive developmental disorder or autism. It can be a peripheral neuropathy. It also, I've had families tell me that, and I've seen in the literature, it indicates that it can be a genetic thing that runs through families. And the other side of it, it can be a sensory issue, that if you look at other issues, the kid tends to be more sensitive from a sensory perspective, and that seems to be the reason behind why they're up on their toes. In terms of treatment of a child who is a toe walker, the first thing I think about is seeing what their ankle range of motion is, how much movement their ankle has, and if it's decreased, especially in the part where your foot comes up, that I work on increasing that range of motion. A lot of times there's weakness associated with it, especially in the muscles that pull up the foot. So I'll work on strengthening the muscles where the foot comes up, but also the calf muscles sometimes are weak. So I'll strengthen those muscles as well. According to the child and what they're doing, I may consider orthotics, and that's like a brace that goes on their feet that might block them from going up on their toes, or it might just remind them that going up on their toes is not the best idea. Sometimes people do serial casting, and that's where you put the ankle on stretch, and you put a cast on that foot for 5 to 10 days, sometimes 5 to 10 days, and then you take that cast off and see if you've got an improvement of range of motion. And if you have, then you stretch the ankle again, and you put a cast on again, and you stretch it again, and then you take it off. And if you've got more range and you haven't gotten as far as you need to go, then you stretch and go one more time. Sometimes they do that in conjunction with Botox injections, and Botox, when injected into a muscle, makes a muscle weak, so they Botox the calf muscle so that it's not as strong, so that the stretches can be more effective. And then if you do all those things, then and the toe walking continues to be a significant problem, then surgery might be considered. In terms of other things that are in the ballpark of what people might do, they might do taping, they might do auditory feedback, they might do electrical stimulation, manual therapy, or joint mobilizations. They really just a gamut of exercises to be able to improve your balance, and gross motor skills are done as well. So those are the things I think about in terms of treatment and the progression of a child who is toe walking. So generally, when I do an evaluation for a child who is a toe walker, I will recommend treatment if one of these things comes up. When I push their foot up, if their foot doesn't go up as far as it's supposed to go up 15 to 20 degrees, and I'll show you what that is in the next video. If it doesn't go up as far as it should, at least 10 degrees up, then I recommend physical therapy. Similarly, sometimes a child has full, what we call passive range of motion when I push it up, but a child can't actively themselves, without me pushing, pull up that foot 10 degrees. And if they can't do that, then I'll recommend physical therapy. Sometimes a child does not have the adequate strength for pulling up the foot. And if they don't have normal strength, so normal strength is they pull up their foot, I can't pull it back down, then I'll recommend physical therapy. I'll tend to do a full gross motor assessment. So I will look at their balance skills, I'll look at their movement skills, and if a child has trouble in their gross motor skills because of the toe walking, then I'll recommend physical therapy. And if their toe walking is interfering in their functioning, if it's making them more likely to trip or more likely to have difficulty balancing, then I'll definitely recommend physical therapy to address their toe walking. So with toe walkers, I usually have 3 goals. I try to get at least 10 degrees of dorsiflexion. That's how far your foot comes up. I try to get 75% of the time that their heels go down, they get a heel-toe gait pattern when they walk, and that they have age-appropriate gross motor skills. This was just a beginning talk on toe walking. It's very basic. I hope, though, this was helpful, and I hope you'll look forward to hearing ideas on how to help children who can toe walk. And we'll look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.